This chapter will highlight how to identify the need for an interpreter. There are a series of steps to take in assessing this need. Firstly, advise clients that interpreters are available and are free of charge. This is important in establishing that the service exists and is freely available to them. Secondly, ask the client if they want or need an interpreter. This is the simplest and most direct way of finding out if patients need one. If the client declines, ensure they know it is your duty of care to ensure effective communication. Explain it is just as important for you to be able to understand what they are saying. It is important to be mindful and not embarrass the client in any way about their language proficiency. Ask the client simple questions about their personal details. This will help you gauge the level of understanding. If they are having difficulty answering, then an interpreter is definitely required. Avoid yes and no questions. If at any point the communication becomes difficult, introduce an interpreter. Try and address client concerns about interpreters. Ensure they understand confidentiality, particularly in smaller communities when the interpreter may know the client. Explain the role of the interpreter and offer the client options of what they are more comfortable with in terms of having a family member present. There is also some information required before arranging an interpreter. Before arranging an interpreter, you need to identify the client's preferred language. This may not always be obvious from the client's country of origin. Assess the suitability of the interpreter. This could take the following into consideration: gender, ethnicity, the limitations on the availability of the language due to a small community base, or rural and regional factors. Decide what style of interpreting is going to be the most appropriate. For example, depending on limitations, a phone interpreter could be more available than a face-to-face one. Perhaps a phone interpreter may also add anonymity and confidentiality in the case of small communities. Finally, make a booking. Follow the booking procedures outlined by your agency or funding provider. Doctor's Priority Line is a free service available to all GP services. But first you must register online. It is easy and simple to use. Please go to the link provided in this chapter to register in advance.